upload the meeting. There it is. We will also upload the meeting after it's complete, and we will put that on the MPCA YouTube channel. So that'll be available for review after this meeting. Just a couple other things before we get started. We will have a smart comment window open after this meeting. That is open now, so we'll drop that in the chat in a few minutes. And with that, I will introduce myself. I'm Lisa Wiedemann. I'm a community affairs specialist with the MPCA, and I'm here tonight just to help with meeting facilitation. So with that, I will pass it off to Cassandra.
Thanks, Lisa. Hello, everyone, and welcome. We're here for the Air Toxics Regulations Rulemaking webinar. I'm Cassandra Meyer. I'm an engineer in the Air Policy Unit here at MPCA, and I'm the technical project lead assigned to this rulemaking. In addition to myself and Lisa, we are joined by our colleagues Anna and Brenda, and I'll have them introduce themselves before we get started. So, Anna.
Hi, Anna Cinco. I am an air toxics risk assessor at the agency, and I'm also working on the air toxics regulation and reporting rules. Brenda?
Hi, everyone. I'm Brenda Vaness, Air Compliance and Enforcement Rules Coordinator, and I'm also working on the technical team for the air toxics regulations, the reporting, cumulative impacts, and odor. And I will hand it back to Cassandra.
Thank you. And as another reminder, we are recording this presentation, so it should be available for review, or if there are people who have missed it, they can see it afterwards. So next slide. Thank you. So if you joined us for or watched the previously the presentations that we gave in either December or February, we'll be covering some of the same content, but we will also get a bit more detailed in the presentation today. We're going to get a little technical because these are technical concepts that we are covering. And if there is some information that you feel you are lacking to fully participate and provide feedback because of the technical nature of these concepts, please reach out to us and let us know what information would be helpful. We can look at providing that additional content either through email or even a separate meeting, especially if there's a group of people that would like to have a conversation. Just let us know. And Lisa Wiedemann would be the primary contact for those requests. And we'll have her contact information included later in the presentation. So please don't hesitate to reach out. So first, we'll go through a few definitions of terms that we'll mention, and then we'll provide some context on why we're working on the rules now. And then I'll provide a brief overview of what the MPCA has been directed to do for air toxics regulations. That'll include a summary of the statute, where we're at in the rulemaking process, the timeline, and then we'll have the material that is new to this presentation, and I'll also be joined by my colleagues Anna and Brenda, and we'll cover a rules structure flowchart, as well as some concepts for what the rules could look like. And then we have a list of questions that we would appreciate your input on to help guide our direction, and those will be listed within the smart comment page that we have live now. So as we go along, you can also add your questions to the chat, and we should have time at the end to answer those questions if we have answers at this time. So a few terms that are used in this presentation are included here. Rulemaking is the process used by government agencies to create, modify, or repeal rules and regulations. These rules and regulations are a form of administrative law that governs the conduct of individuals, businesses, and other entities within the jurisdiction of the relevant government agency. And we are going through the rulemaking process for air toxics, and air toxics are pollutants that are known or suspected to cause cancer or other serious health effects or adverse environmental effects. And there are a specific set of air toxics that are known as our next definition, and that is hazardous air pollutants, or HAPs. And there are 188 air toxics defined in the Clean Air Act. In discussing the concepts for the rules, as well as our list of questions that we're seeking feedback on, you'll hear us talk about health risk values. And a health risk value is also known as an air guidance value. These are concentrations of a chemical that is likely to pose little or no risk to human health. And these values are used in analyses to determine human health risks from exposure to chemicals in the air. And then lastly, we have criteria pollutants, and those are 6 commonly found pollutants that have ambient air standards as required in the Clean Air Act. And those pollutants are listed there, with lead having an asterisk, and that is because lead is both a criteria pollutant and also an air toxic. Next slide, thanks. And as a little more context around air toxics and what they are, we have some examples here. Air toxics can include metals, dioxins, furans, benzene, PFAS, otherwise known as forever chemicals, TCE, and more. Impacts from air toxics can include cancer, so that's dependent on the specific pollutant. Not all of them have a cancer endpoint, but it can also include respiratory issues, cardiovascular issues, and other health effects. Sources can include combustion, wildfires, transportation, solvents, and others. For some context of where we do already have authority on those 188 hazardous air pollutants, or HAPs, this comes from, as I mentioned earlier, the Clean Air Act. We'll go through a very high-level overview here of that. It's not exhaustive, but the Clean Air Act was established or enacted in 1970. It provides the authority on the federal level to regulate air pollution. It largely regulates 6 pollutants known as the criteria pollutants. It also provided authority to establish national standards for hazardous air pollutants, or NESHAPs. There were the 1990 amendments, and that established the list of 189 originally HAPs, or hazardous air pollutants, and the authority to regulate them. EPA was also directed within these amendments to adopt air toxics control standards, where they had to identify industrial sources emitting HAPs. They had to identify maximum achievable control technologies, or MACTs, and they had to conduct risk assessments afterwards to ensure that the standards were protective. And today there have been some changes to the list, and currently there are 188 HAPs. And we, as a state, are delegated to enforce those standards that EPA created for the 188 HAPs. And on the right, we have a graph, also from EPA, that shows the trend of the 6 criteria pollutants going down over time, while the gross domestic product goes up, which implies that controlling and decreasing pollution can occur while also the GDP, or economic health, goes up. And so we have some authority on the federal level to regulate HAPs. Why are we doing this rulemaking now for air toxics? The MPCA implements federal air toxics regulations, and also it is important to know that these are the minimum that regulated facilities must meet. The Clean Air Act doesn't limit the state's authority to regulate air pollution, and states can have more stringent and more environmentally protective laws and requirements. There are also geographic and economic differences in every state, and states will look at local needs and create more rules. And therefore, That is what the legislature did in 2023. They found that there was a need in Minnesota to have state air toxics rules, and so they directed us to do rulemaking. This is the first rulemaking of its kind for Minnesota, where we are directed to regulate a breadth of air toxics. MPCA has had voluntary efforts around air toxics, working towards reducing pollution, but again, those are voluntary actions that a facility would take. And since federal regulations do not necessarily cover every pollutant, just those 188 HAPs, these rules will hopefully improve air in the metro area where the air toxics rules will apply. So again, the most simple answer to this question of why now is that we were directed to do this by the legislature. And moving forward with this direction, what were we told to address? This is an overview of some of the details in the statute. And the statute specifically requires that the commissioner adopt rules to implement and govern regulation of facilities that emit air toxics. So we have to implement and govern regulation of facilities that emit air toxics. There were some restrictions laid out for us, and those are included here on that slide. The first is that we are on a 3-year timeline. And we have to get our draft rules on notice of intent to adopt by May 18th, 2026. And we're still in the developing stage at this point in the process. The rules will only be applicable in the 7 counties of the metro area. Also note that they are not limited to only environmental justice areas. They will apply to everywhere within the 7 counties listed here. The rules will not apply to facilities with registration option B permits. And registration option B permits are for sources that purchase or use less than 2,000 gallons of VOC containing materials on a calendar year basis. In the metro area, these are mostly auto body repair shops. On the right side of the slide, these are things that we are directed in the statute to address at a minimum, and that specific language is in the statute as well. This sets the floor for our efforts and not the ceiling. And these items include that we must address specific air toxics, types of facilities, performance tests, monitoring of emissions, reporting requirements, record keeping, inspection frequency. And we also are directed where our rules must reflect risks to human health and the environment, a facility's compliance record, and residents' exposure in environmental justice areas. We previously asked for specific input on how we should accomplish this last point, where the rules must reflect exposure of residents in environmental justice areas. And we're bringing that question back because we'd like to continue receiving input on this, because again, these rules will apply everywhere within the 7-county metro area. So we'd like to hear your thoughts on how to work out this nuance. And you can see here the timeline for the rulemaking. We are past the formal request for comments period, but we're still in the development phase of the process. At this point, we are currently working on developing concepts for how to structure the rules. And we are here because we're seeking feedback and guidance from the public on those concepts. And so we appreciate and really want to hear from the people who will be most impacted by these rules. Similar to what we're doing now, from December of last year until March of this year, we had a smart comment page open. And we posed a little more specific questions to get public feedback back then. We received 14 comments, and thank you to those of you who provided those comments. They are available for anyone to review on our rulemaking webpage, you can check those out if you're curious what other people have submitted so far. We also have copies of the comments that we received during the formal request for comment period. And the feedback that we've received from comments so far have helped guide our discussions, and they've also provided perspective when we've looked into possible concept options. All right, so here we are going to get into the concepts for the rules so far. And we want to preface this with the caveat that all of the information is conceptual. Even the terminology that we're using is limited to this rulemaking effort. So we appreciate everyone's time and contributions to this effort. We really are hoping for feedback on the conceptual framework so far. We don't have any proposed rule language to respond to at this point yet. We're still working everything out. So this is all draft, all conceptual. Okay, so what we see here on this slide is a draft rules structure flowchart. This is a conceptual framework. It generally outlines how we're looking to potentially structure the rules in Minnesota. This is similar to what we've seen from other states. And it does not include all the details, like where there may be exemptions. I'll note here that on this and the following slides, we've included questions that will be on our Smart Comment page, so you can think about the feedback you might want to provide as we're going through the concepts. We may or may not read those individual questions in the moment though, because we will go through them all at the end. So the related question here is, are there sources that should be exempt from air toxics rules? And if so, what criteria should determine this? And so I'll walk us through the steps in this flowchart, and then my colleagues will take us through a little more detail within the different steps. So the first step is a screening analysis. Facilities or regulated parties would calculate their actual air toxics emissions. They then would compare those emissions to screening thresholds. And that's that first diamond there at the top, second box. I'll note that with these screening thresholds that there's a lot that could go into determining these values. And in the future, we are hoping to have engagement opportunities about the screening values themselves, but not quite yet. We're not quite there yet. All right, so a facility would have calculated their actual air toxics emissions. They will compare them to the screening thresholds. And then if those emissions are below the screening thresholds, there's no further action needed. If the air toxics are above the thresholds, then there's two paths here. A facility can make operational changes and or take permit limits to stay below thresholds. Or they can model to show risks. And this is also called an AERA, or air emissions risk analysis. And so that top area, that's the screening analysis. And then we have a second analysis, and that's the risk analysis. You can see that second little diamond box there. So that risk analysis could be required for or chosen by a facility. And so if a facility, either way, if they choose it or they're required to do a risk analysis, if they do the risk analysis, this will be a bit more involved because they compare modeled emissions to risk values. And then if those modeled emissions are below risk levels, then again, no further action is needed. But if they are above risk levels, they will need to make operational changes and or take permit limits to reduce risk levels and or develop an enforceable reduction plan. So this flow chart is a broad tier 1, tier 2 structure here that involves first screening and then potentially modeling risk. And so my colleagues Anna and Brenda will discuss more conceptual details around these steps. And I will pass it to Anna to discuss screening values and screening process. Thanks, Anna.
Thanks, Cassandra. Yeah, just a reminder, my name's Anna Cinco. I'm an air toxic risk assessor at the agency, and I will be going over the screening values and screening thresholds that we are thinking about. So the screening thresholds are risk-based values that are different for every given pollutant, stack height, and distance to fence line. Screening values are calculated using air dispersion modeled concentrations and health risk values. The health risk value is divided by the model concentration to give a value per stack height, distance to fence line, and pollutant. We are looking at pollutants that have health risk values associated with them. And so to find these screening values, air dispersion modeling was done of 13 different stack heights, from 3 to 61 meters, which is about 10 to 200 feet, and 37 distances to fence line, which ranged from 5 to 2,000 meters, which is about 16.4 to 6,562 feet. These stack height and distance to fence line were determined by collecting data across the 7-county metro, and were determined by looking at modeling done by New Jersey. We are looking at all options, which includes looking at different time durations. This includes looking at an hourly pound per hour screening value and looking at an annual ton per year screening value. And the smart comment question we have is, should the MPCA limit/regulate air toxics where there are no health risk values established, such as PFAS? Great. So a little more detail on those short duration screening values. We're looking into the short duration or less chronic screening values to assess the risks the facility would have to provide a pound per hour number for each pollutant. However, there are less pollutants with an acute or short-term risk compared to a chronic risk number. Looking at past air emission risk analysis or ERAs, we found that out of the inhalation risks, which would be acute, subchronic, chronic, and cancer, that acute was a driving risk for those, followed by the cancer inhalation risk, which would already be accounted for by looking at those chronic screening values. And some smart comment questions we have are, how much effort do you expect would be required for screening threshold analysis? For example, hours, cost, etc., to calculate air toxics emissions. Another question we have is, for facility reps, what actions would you be willing to take to stay below screening thresholds? Some examples are move/change stacks, other operational changes, etc., or would you opt to do an ERA instead? And for the screening process, we are considering using actual emissions as opposed to potential to emit emissions. Most, if not all, facilities already calculate their annual HAP emissions. Additionally, most of the air toxics listed or that we're looking at with those health risk values are HAPs, so there's not too much additional work. And by looking at actual emissions, we are trying to focus more on facilities that actually pose a higher risk. Additionally, we have the air toxics reporting rule that would impact the 7-county metro. This rule is not final yet, but facilities would already be required to calculate their actual emissions through this rule. We are also developing a screening spreadsheet. Facilities would input their stack height, distance to fence line, and emissions information. And then from the spreadsheet, the facility would be easily be able to tell if they're above or below a given threshold for each pollutant. Some questions we have are, how could this be made easier if we go this route, and what support could be helpful? And I will pass it back off to Cassandra.
Thanks, Anna. So a few overarching permit-related concepts are on this slide, and those are things that we are considering again. The first is that all existing air permit holders, no matter the type, may be required to do that first screening analysis. The exception, of course, is the option B registration permit holders, because the statute specifically exempts them. We could consider exemptions with reasonable evidence that there's little to no risk. Example where this could be an option is if an ERA or a risk analysis has already been completed for a facility, or if there are applicable niche acts where there has already been a risk analysis for that regulation for that specific niche act, or something else. We are considering that for future analyses, those could be required for new permit holders or existing permit holders where MPCA has new information or evidence of a significant increase in air toxics emissions. And then looking at the situation where a facility is above screening thresholds and they decide to make operational changes and/or take permit limits to stay below thresholds, those actions could require a permit amendment and/or a compliance determination protocol. And these are two possible options or tools. My colleague Brenda will discuss more details around these and the difference between them. But at this point, I want to note that there are many types of permits, and we are, you don't need to understand all of them or know what they're all called, but we're thinking about them in two different buckets at this point. So the permits types that can be amended and the permit types that cannot be amended. And so that's why we are looking at different types of tools and possible options. So I'll pass it on to Brenda.
Thank you, Cassandra. Hello again. I'm Brenda Van Ness, the Air Compliance and Enforcement Rules Coordinator, and I'm going to be going over some requirements that we're considering for facilities that end up being above risk levels and/or screening thresholds. And so for facilities that are above screening thresholds, we would like those facilities to try to get below screening thresholds. And we have a couple different options that we're considering that would allow facilities to get below those screening thresholds. And the first one, and as Cassandra had mentioned, there's a couple, very broadly speaking, there's two different buckets of permits for when it comes to amendments. You have facilities that can amend their air permits, and then you have permit types that the facility cannot amend those permits. So this first option would be especially applicable for facilities that can do amendments. We're considering having the option to amend their permits. So the facility would have to determine what they need to do to get below screening thresholds, whether that's through taking limits or restrictions on throughput or hours of operation. And then they would also have to determine what type of air toxics monitoring and testing they would need to do to figure out that ensure that they're below the screening thresholds and stay below those screening thresholds. So an amendment would be done to include the restrictions or limits that they're taking, the air toxics monitoring and testing that they would be doing. They would submit that amendment, and then the amendment would follow the standard permitting process with those requirements stated in permit. So again, this would be for the permit types that do have amendments as options in their permit type. However, facilities that do not have permit amendments as an option, we're considering, next slide. We're considering having a compliance determination protocol as an option. So in this case, the facility would come up with a protocol or a plan where they're outlining restrictions that they're going to take or limits, and then also monitoring of facility operations. to get below and stay below those screening thresholds. And so basically, this protocol would become an enforceable part of a permit where they don't have amendments available as an option for their permits. So the facilities that can do permit amendments, they may be wondering, should we do a permit amendment? Should we do a compliance determination protocol? Which one would be required? And so potentially this is going to depend on the permit type, as I mentioned, as well as permit timeliness factors, both for the facility and for the agency. And so ultimately we're considering varying the approach based on the permit type. And that's one of the questions in some of our comments that we're looking for feedback on what your preference would be between these different options. And as Cassandra had mentioned, the next step in this flow chart, if a facility cannot get below the screening thresholds, the next step in the process that they'll have to do is to model to determine what their risk levels are. Again, if a facility is not above risk levels, there's no further action. However, if a facility is above risk levels, the next step or requirement that we're considering is for the facility to do an air toxics reduction plan. This plan would be similar to a compliance determination protocol, but it would be more comprehensive and restrictive, and it would potentially, or the facility would potentially need more time to implement this type of plan. And the reason for that is that the facility may need to install control equipment, they may need to phase out air toxics containing material, or other things that would take a longer amount of time as opposed to just implementing a limit or restriction on operating hours or throughput. And with that, oh, sorry, one more slide here. So to try to provide a bit of clarity between the compliance determination protocol and the air toxics reduction plan, we've got some bullet points listed here under each. These are very high level, kind of broad concepts for these. Each one of these, it does not go into specifics. But on the left for the compliance determination protocol, this would only apply to facilities that are above screening thresholds. And the protocol would focus only on the air toxics in units receiving limits and restrictions. It would not focus on any other toxics that are below the screening thresholds. Direct measurement or stack testing would only be required in certain instances. And the facility would also, in the protocol, have to justify why they're choosing the measurement method they're selecting. And those measurement methods will likely be driven by limits or restrictions, such as operating hours, throughput, or material toxic content. And we're considering not having a formal approval process for the compliance determination protocol. Facilities would have to submit these protocols and the agency would review them. If we found them to be insufficient, we would send them back for revisions. On the right side, we have the bullets for the air toxics reduction plan. Again, this would just be for facilities that are required to model, and their modeling results show that they're above risk values. The plan would require all air toxics and units at the facility to be included in the plan, regardless of whether they're above or below the risk values. They would have to incorporate all toxics again at the facility. Direct measurements or stack testing would be required if it's possible. And then in the plan, the facility would also have to explain all the measurement method options available, and they would have to justify why they chose the method selected. And this plan would require a formal approval by the agency. And so again, as I mentioned before, there's kind of two different permit types that when it comes to amendments, some can be one bucket can be amended, the other one cannot. So the facilities that do have an amendment available to them in their permit type. We're considering having those facilities amend their permits to incorporate either of these protocol or plan into their permit. And with that, I will hand it back to Cassandra.
Thanks, Brenda. Again, we want to reiterate that all of this information is conceptual, even some of the terminology that we're using. We appreciate everyone's willingness to participate in this way. We don't have any proposed rule language to respond to yet, but we are hoping for feedback on these draft conceptual ideas. And here we have the specific questions that are on our smart comment page. You can answer any or all of them once you navigate to that webpage. And we will also have a catch-all question for feedback that you want to provide that is not related to any of the specific things that we ask. And I'll also acknowledge that there are quite a few questions that are more directed towards facility representatives or consultants with specific experiences, but these questions are open to anyone, and we welcome everyone to provide answers and feedback. And as I go through these, I'll call out where there are some that would help to have responses from the broader general public in particular. So I will read through these. And so the first is, how much effort do you expect would be required for screening threshold analyses, hours, cost, etc., to calculate air toxics emissions? How could a screening process be made easier? What support could be helpful? If you have a registration or a general permit, would it be possible to track operating hours for each emission unit, or is it more reasonable to track hours of operation on a total facility level? Would facilities that are over screening thresholds prefer to submit a permit amendment, develop a compliance determination protocol, or both? If you work for a facility, what actions would you be willing to take to stay below screening thresholds? That could be moving and changing stacks, other operational changes, etc. Or would you opt to do an ERA or risk analysis instead? If you've previously completed an air emissions risk assessment or analysis, an ERA, what was the cost range for this work? And how much time did it take? How much time is reasonable to develop an air toxics reduction plan? That could be 6 weeks or 8 weeks, 6 months, 1 year, some other time frame, and why? And then once that air toxics reduction plan is developed, how much time is reasonable to comply with an air toxics reduction plan and why? And then these next 3 questions in particular, and all of the following questions on the next slide, those would help to have responses from the broader general public as well as regulated parties. So after completing a risk assessment, if a facility cannot comply with an air toxics reduction plan, what are reasonable alternatives? What kind of public notices would you like to see required by these rules? And some examples are listed here, and those could include when you are above, when a facility is above screening thresholds and making changes to the facility, when a risk assessment is just completed, or potentially when a risk assessment is completed and a risk reduction plan is required, or some other time. And should petitions be allowed? And if so, what actions should be allowed to be petitioned for? Please share any example you might have. Okay, And these are questions that we asked during the previous informal smart comment period, and we're asking them again because we would like to continue receiving feedback on them. And again, it would help to have responses from everyone, including the broader general public and regulated parties. So according to the statute, the rules must account for any exposure of residents in environmental justice areas to facilities' air toxics emissions. How do you recommend accomplishing this? Should the MPCA limit or regulate air toxics where there are no health risk values established, such as with PFAS? Are there sources that should be exempt from air toxics rules? And if so, what criteria should determine this? So those previous slides, those are questions that we're asking on our smart comment page. And aside from those, we're also asking that if you have preferences for how you want to be engaged, if there are other ways to reach you or other people that we should be involving, if there's additional information or updates that you'd like to see, please send those ideas and preferences to Lisa Wiedemann. Lisa is our community affairs specialist who kicked off this meeting this evening. This is her contact information listed here. And we just really want to make sure that we're able to connect with people in ways that work for all of us, and that we're providing information and engaging in ways that are helpful, both for the public, regulated parties, and us as we write these rules. So, and then I'll also say that we are looking for more ways to engage as we develop these concepts further. Yes, and I see Lisa is dropping her contact info in the chat as well. So thanks, Lisa. So this is how you get to the smart comment page. We have a QR code. You can use your phone's camera app to navigate there. There's also a direct link that will drop in the chat. And then on the right side of the screen is an example of what that first landing page on smart comment should look like. And just underneath those boxes, there are the specific questions, and you'll actually just scroll through them. So it's a little bit different than our general public comment pages and how they're set up, but each individual page you'll have to scroll to it. Or each individual question, you'll have to scroll to it. So, and you don't have to answer all of them. You can answer any of them one at a time. You could answer all of them. We'd love to hear from you on any of them. So this comment period, this informal comment period will be open now through October 2024, October 18th, 2024. And then lastly, we want to encourage everyone to sign up for our email listserv. This QR code will take you to our rules webpage. We also have the direct link there that we'll drop in the chat as well. And if you haven't already signed up for our email list, once we get to that notice of intent to adopt, for sure, we will be sending out an email to everyone through that listserv, and also any future engagement opportunities we will also announce through this email list. So once you get to our rulemaking webpage, you scroll down a little bit, there's that gray stay connected box, and just fill in your email and tell all your friends. All right, thank you all for joining us. This is our contact information for myself and my colleagues, Brenda, Anna, and Lisa. And I'll turn it over to Lisa to help facilitate taking any feedback or questions that may have come through during the presentation.
Thank you. We'll open it up for questions. I know a couple of folks did drop questions in the chat as we were going through. I'll just go ahead and read the first question that came in. Are the actual emissions calculated prescribed to be based on a specific baseline year? Will that be consistent for all potential affected facilities? And then there was a clarification, are the actual emissions to be based on a specific baseline year or time period?
Yeah, thank you. That is a great question. We haven't determined that, and we haven't looked at that specific detail yet. So if you, I believe it was Daniel that posted that, if you have experience in other states having done that, or if you have preferences, please, like, you can either tell us now, or if you want to think on it, we would love to hear feedback around that as well. That's a great detail to get input on.
I'll add that the SMART comment, we do have those list of questions, but if you feel like you have input or a question that doesn't match our questions, we do have a couple of like catch-all, what else should we know? So just feel free to put content in there. Doesn't have to be only answering the questions that were listed. Let's see, we do have one more question listed here. So the New Jersey screening spreadsheet is essentially MPCA's RASS. So is it a correct assumption that the RASS would be used as a screening threshold?
Yeah, and I can go ahead and answer that. So the RAS spreadsheet is our risk assessment screening spreadsheet that we use for our ARAs. Again, that's our air emission risk analysis. So to answer your question, the screening spreadsheet that we're putting together and looking into would be similar to our RAS spreadsheet. However, in our RAS spreadsheet, you can model to get the air concentrations, and then you can overwrite the default dispersion numbers that are in the spreadsheet. For the screening spreadsheet that we are looking into, you would have to use the default numbers that are in the screening spreadsheet. You wouldn't be able to run your own modeling. However, if you get to the ERA stage, that is where you would be able to run your own model for your facility.
Right, thank you. We'll hold on for a few minutes here. So if anyone else has a question, you're free to drop it in the chat. Definitely encourage that. If you'd rather follow up after, we do have those emails still listed. So feel free to contact us directly or submit questions in Smart Comment. I'll add also, you know, if you're not representing a facility and maybe you're a member of the public and just coming into air toxics and maybe looking for a background, we do have some other webinars that are uploaded on our YouTube channel, the MPCA YouTube channel. You should be able to search and find those relatively easily on YouTube. Search MPCA air toxics and a handful should pop up for you. You're also welcome to email me directly if you're looking for just like a one-on-one little bit of background. That would be totally fine. And if you're looking to engage in the future, this is not our last engagement. We'll be doing additional engagements as we move on here. And I do see another question popped up in the chat. This is a question that says, will this review be tied to the air toxics reporting rule, or is this rule a means to reevaluate issued permits?
I think I can answer this one. They are separate rules. And one way that we are considering that they would be overlapping is with that first screening step. And that's why we were considering that step can include actual emissions instead of potential emissions, because the air toxics reporting rule will already require facilities to calculate those. And so it's just one way that we were thinking that this would be easier for regulated parties to use work that they're already required to do from another rule. I hope that answered the question.
Great. I'll do I see another one coming in. Excellent. Okay. Is the screening threshold going to be by individual HAP? So each HAP and emission source at a facility would be evaluated individually, or is the current framework to have the screening threshold be the total unit risk of all HAPs summed together for an entire facility, like an ERA?
I can go ahead and take this one. So we are still looking into all the possibilities by looking at individual stacks versus the whole facility. We plan to have another webinar where we kind of go into depth more on the screening step. So look out for that as well. So to be determined.
And I'll add that that's a great question or contemplation to put into smart comment. So feel free to do that. And I will call out that chats received here are not official comments. So we don't have a great way to memorialize these into smart comment. So if you have questions that you want to make sure we stay on top of, please put those in smart comment. I see another question came in. So are facilities evaluated annually, or is it envisioned to be like a one and done type process?
Yep, great clarification. At this point, we are thinking that it would be everyone would this once. And then, so there was the permitting concept slide where we are considering then new facilities. So everyone would kind of one and done. Unless we received new information about a facility, and then we would request that they redo the analysis, or we might, maybe it's something that we are able to check on our end. But at this point, one and done, unless like a significant increase in air toxics happens at a facility. And if people think that that's not enough, we're also open to feedback around that.
Excellent. We'll stay on for a couple of minutes. I'll keep monitoring the chat for any final questions. Okay, see a question came in. Do you anticipate a work group for determining the pollutant list? Will there be a process for adding or removing pollutants from the list?
Interesting. We have not discussed having a work group because we are on a pretty tight timeline. But yes, if there should be a process for adding and removing pollutants, that could be feedback that's provided through smart comment. We haven't gotten to that level of detail yet.
Okay, great. All right, see another question. Facilities that hold registrations that are required to report annually, will these sites be required to go through modeling?
Not necessarily. And that's why we're splitting up conceptually right now, we're splitting up those two processes. So it would just be a screening analysis that for sure everybody would go through, and then potentially modeling. Yeah, on that flow chart. So if you're above screening thresholds and you can't make changes to get below the screening values, then there would be modeling as another option.
Good questions coming in.
Mm-hmm.
Okay, we'll give it maybe 1 or 2 more minutes. Last call for any questions. Feel free to put them in the chat. Okay, I have a second question. Have the thresholds been determined for HAPs and VOCs?
We don't have specific thresholds determined, and that is something that we hope to in the future have another engagement opportunity around, because there's a lot of things that could go into determining those values. And so if you sign up for our email listserv, we'll make sure to announce that when we are bringing that forward for feedback. Or if you have ideas now that can also go into smart comment. We can start considering those.
Excellent. Really appreciate everyone's willingness to listen and participate today and ask a lot of thoughtful questions. This definitely helps all of us move forward. We'll do one more minute. Where do we sign up for the listserv? Hannah, could you drop that link in the chat one more time, please? I'd really appreciate it. Thank you. Okay, so the links just dropped in the chat. The first one is for feedback in smart comment. So that's how you provide feedback based on today's questions and presentation. The second link is the more info link that takes you to the air toxics regulations webpage. And then you do just need to scroll to the bottom and there's a little box that says stay connected. If you put your email address in that box, then you'll automatically be on our listserv. And you'll get updates related to this rulemaking. Great.
Another note about the establishing the thresholds for HAPs and VOCs and all air toxics. We are hoping to have these thresholds in rules so that they will formally go through a public review process. So it isn't something that wouldn't be reviewed and have that check during that process.
Okay, maybe one final, very last call, going once, going twice for questions. And if you think of a question later on, maybe after the presentation, you've had some time to think about it, you are more than welcome to reach out and or to drop those comments into the smart comment link. Be helpful for us moving forward. Okay, I'm not seeing any other questions come in. Excellent. Well, thanks everyone. We really appreciate it. Thanks for taking the time to join us this evening. Again, put your comments into smart comment. If you have more questions or you want a one-on-one conversation, please reach out either to me. I can help with the basics, or if you know you have a technical detailed question, feel free to reach out to Cassandra or Anna or Brenda as needed. Thanks everyone.